The Dr. Fazal Show is brought to you by Health Tips Media. The Dr. Fazal Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hi folks, I'm Dr. Fazal. You're watching 2025 October Dr. Fazal TV show. The topic for discussion today is how to keep your kidneys safe. I think this is an important topic, although it seems like a very subtle topic, but it is important because if you can stay out of trouble and never have a kidney problem in the first place, then you don't have to fix it, right? So prevention is the key. So I figured it out, like, why don't I educate the patients to protect their kidneys instead of fixing it, which is not very successful all the time, although we hope it gets better, but sometimes, damage is permanent. So here's a few tricks. Well, you have to know what the kidneys do. Kidneys filter blood, right? It makes urine, but they also do a few other things. They do blood pressure control, right? So your blood pressure control is done by the kidneys, not by the heart. So it is a very common misconception that, oh, I need to see a heart specialist for your blood pressure management. Your blood pressure specialist is your kidney specialist. Just remember, this is a misconception. I want to clear off that today because I hear that over and over that, oh, I have to be seen by a cardiologist or heart specialist for my blood pressure management. It should be the kidney specialist. They specialize in blood pressure management. So that's number one. Number three, they clean up the blood, they make urine, take the toxin out of the kidney, control the blood pressure. And they also make blood too, by the way. So they produce a certain chemical or hormone known as erythropoietin, which causes bone marrow to make blood. So if you have anemia due to whatever reason, well, most of the reasons, then the kidneys will release that hormone in the blood and cause your kidneys, your bone marrow to make more blood. So now we have three functions, right? So we have urine formation to remove the toxin from the blood, control the volume of your body. If you drink too much water, it will get rid of excess water to the urine. So electrolytes imbalance, your blood pressure control, your hemoglobin or anemia control, and then also the volume control. So those are the basic, and they also make vitamin D. It's also surprisingly, people are unaware of that vitamin D is activated when whatever vitamin D we take, either it comes from the sunlight or from oral intake, it has to be in activated form to be useful in the body to act on the bones. We call it activated vitamin D. So first it goes to the liver, and that's first time activation. Second time activation is kidneys. So the vitamin D have to be activated twice in two different places for it to be active, and it doesn't matter what source you take. Either you take a pill or you use your skin for sunlight and try to build internal vitamin D, but they have to be changed to active vitamin D to get it working on the bones, or you're gonna have a bone loss, right? So those are the important function of the kidney. So it is obviously a very vital organ. The next question would be, okay, kidneys are important. There are two kidneys in the back most of the time, in the upper mid back. So, well, obviously prevent the physical trauma. Don't get punched at the back. It's gonna hurt your kidneys, all right? Number two, drink enough fluids. If you don't have swelling in the legs, you can drink fluids to keep the kidneys flowing. Kidneys like water. Low protein diet. Don't go on too much heavy protein diet. 1 gram per kilogram per day. That's the formula. So if you 70 kilogram, between 170 to 100 gram of protein you should be able to take without any significant health risk to the kidneys. So certain kind of medication, ibuprofen, morphine, naproxen, excessive use of that can cause damage to the kidney as well. Iodine, which is used in CAT scan and angiogram, too much exposure to that can also cause damage to the kidney. And there are other things too, like if you have a high risk other medical conditions like hypertension, high blood pressure, diabetes, high cholesterol. They all go through the kidney, right? So we need to make sure your diabetes is controlled. Your hemoglobin A1C, which is the average of your last 3 months, should be 7 or less. Blood pressure should be 140 top, 90 bottom. Should be less than that, or 140 or 90. And then your total cholesterol should be 200 or less. So those are like few things which are systemic, and if they can affect everything, including the kidneys. So folks, do control the risk factors. If you do all that, you can have a healthy kidney for a long period of time, and you don't have to see a kidney specialist. So folks, if you do find out that you have a kidney problem, which could be found through a blood test or urine test or imaging, or some imaging modality like your sonogram or CAT scan or MRI, or then if you do have a problem, don't ignore it, get it fixed early. Don't wait till it gets to the next level. You will not have kidney symptoms till kidney function is really low. So don't wait for the symptoms, folks. Early intervention is prevention. That's the key here. So on that note, folks, I will call it a day. I'll be back next month with a more useful topic for your information. Thank you for watching Dr. Fazal TV show.